All right, good morning, Labor, Health, and Social Services. Welcome to March 1st, 2024. Barb, if you would call the roll to get us started.
Representative Chadwick?
Here.
Representative Clauston? Excused?
Excused.
Representative Hornoff?
Here.
Representative O'Hearn?
Here.
Representative Penn?
Here.
Representative Trujillo?
Here.
Representative Ward?
Here.
Vice Chairman Yin?
Here.
Chairman Zwanitzer?
Here.
Thank you.
Thank you. Hey, it's nice to have all 8 of the 9 of us this morning. First up today will be Senate File 57, Wyoming Adult Hearing Aid Program, brought to us from our good senator from over the hill. Welcome, Senator Furphy. The floor is yours to present Senate File 57.
Thank you, Mr. Chairman. Again, Dan Furphy, Senate District 10. Thank you all, committee members. Let me explain the genesis of this bill and what it's about. A little over a year ago, I was asked to attend a meeting, and I said, sure. And when I showed up, it was a group of deaf individuals, and I had no idea at the time the number of deaf people we have in our state. And mostly the first meeting was just representatives from where I'm at, across the hill, and this community, and I was surprised the number. And so after meeting with them, I agreed to originate a meeting with the governor. And so the governor agreed, and surprisingly, the number of people who showed up with the governor, and the governor was very sympathetic to these people. They're not getting the help they need. Mr. Chairman, we're the only state in the country that doesn't have a commission for the deaf. So the governor assigned his senior policy advisor, and I won't use her name, but anyway, we're closely with her, and what we developed a program for the deaf and hard of hearing in our state. And it's a multi-period program. And what we agreed on was the first step is to get hearing aids to these individuals. Now, this is not hearing aids for the general public. This is hearing aids for the extremely hard of hearing. So, Mr. Chairman, I'll run through the bill now that I've kind of laid out the background. I'm using the engrossed version of Senate 57. So if you go to page 2 of the bill, when we talk about department, it's the Department of Health, and I work closely with them on developing this program. So on page 2, line 10, Romanet II, eligible adult. And why we're saying adult, we already covered children under the CHIPS program. I'll talk maybe a minute about that in the future here, but so it's for adults, line 12, they have to be diagnosed by a physician or an audiologist with, and this is a key, profound hearing impairment. That's actually a loss of 81 decibels or more. So it's significant. And the other requirement, Mr. Chairman, who has a monthly modified adjusted gross family income at or below 200% of the federal poverty level. Mr. Chairman, what we're trying to get to is a lot of the deaf community is struggling financially. And so if we can get some hearing aids to some of those people, they can maybe hold down a job. They want to work, they really do, but they have a tough time when they can't hear enough to hold down a job. Mr. Chairman, on page 3, line 8, eligibility under this program will be determined by the Department of Health, and it's for people who do not, at this point, be eligible for receiving hearing aids through private insurance, Medicaid, Medicare, or any other third-party provider. And the balance of the bill just talks about they can only qualify for hearing aids every 5 years. And in terms of appropriation, the Department of Health said they can implement this program for $9,000. And there's appropriated to start this program, once again, visiting with the Department of Health, and $90,000 to provide the hearing aids. So, Mr. Chairman, that's the basis of this bill. I really want to try to help the deaf and hearing impaired in our state. And so, Mr. Chairman, this is a start. This is not the long-term solution, and we do have a plan to working on the longer-term solution, and the Department of Health will try to fund more longer-term financing alternatives for this. So, Mr. Chairman, I'll stop there and answer questions if I can.
Questions? Representative Chadwick, go ahead.
Thank you, Mr. Chairman. So, Senator, any idea, we're seeing the numbers, but any idea how many people might be qualified for this program?
If you know.
Thank you, Mr. Chairman. Representative did talk to the Department of Health, and they're estimating, and there's obviously no current waiting list because this program hasn't been implemented, but their estimate at this point that there may be 367 people that might need help.
So your anticipation is that this will probably have to go on. This looks, at $90,000, that'll cover roughly 180, so you're halfway there. So it'll likely need to continue into the next biennium.
Senator Furphy.
Mr. Chairman, Representative, yes, that's part of it. The Department of Health will continue to look for funding sources, and this is just to get this program implemented, started, and yes, a lot of long-term work has to be incorporated.
Other questions for Senator Furphy? Your Representative Hornock, go ahead.
Do we do this for people who are nearly blind or people who need dentures or something like that as well? Are there any other programs that we could compare that are similar to this that we have going on in the state of Wyoming?
Senator Furphy, if you know, certainly the Department of Health would when we call them up.
Mr. Chairman, I think there are representatives from the Department of Health that could answer that question more readily than I can. But Representative, I will say, there is a commission for the blind in our state, but once again, no commission for the deaf.
Other questions for Senator Furphy? Not seeing any right now, Dem. But maybe stick around if you can. We might have some questions at the end. Department of Health, Mr. Fuchs and Mr. Grossman, both. Welcome to Labor Health. The floor is yours to talk about Senate File 57.
Mr. Chairman, members of the committee, Lee Grossman, State Medicaid Agent with the Wyoming Department of Health, joined to my left here by Franz Fuchs, Policy Analyst with the Director's Office. We'll keep our comments relatively brief, stand for any questions from the committee. I would draw your attention, I would draw your attention to the fiscal note. As the sponsor, you already heard from the sponsor of the bill, we were consulted in the drafting of this bill and tried to provide information to the best of our ability. So the estimates you see in the fiscal note are about 30 individuals who could be served through this program based off of the current appropriation. Again, that's based off of the rates paid for currently by Medicaid for hearing aids. That rate specified in the bill here as well. There could be some scenarios where more individuals would be served. Let's say if the cost would be a little less, an individual needs one hearing aid rather than a pair. But obviously we want to be conservative in terms of the total impact. With that, again, I think our stance as the department is obviously neutral on this bill, but want to make ourselves available for any questions from the committee.
And so it only covers hearing aids, not any type of implants or anything other than what the standard Medicaid hearing aid would cover? There's like 3 or 4 options from what I remember. Is that correct?
Mr. Chairman, yes, that's correct, and that's our interpretation of the bill.
And your AWEC, is it going to be a position or are you combining positions? Or do you know yet? 9,000 seems like a weird number for an appropriation for a part-time position. So maybe some detail on how that might work.
Mr. Chairman, absolutely. I'm sure you won't be surprised to know that we cannot hire a full-time AWAC for $9,000. So just you can rest assured there. The intent, since this is such a relatively small program in terms of the Medicaid program, we would try to do this as efficiently and as manually as possible. We obviously have the infrastructure within Medicaid in terms of getting payments out to providers, eligibility, verifying eligibility in terms of the requirements in the bill. And so we would seek to do that on more of a part-time basis, obviously not a full-time basis. Given the appropriation, the fact that we would likely expect a waiting list if implemented, this would likely be time limited as well in terms of what the workload would be like.
And I'm just guessing if Wyoming had Medicaid expansion, it would be a lower fiscal note because half of this population would be served by Medicaid expansion, if you'd like to comment on that.
Mr. Chairman, I won't take the bait too much on that one if you'll excuse me. But I'll add that hearing aids are a covered Medicaid service. And that's something that we can certainly provide more data on in terms of the numbers served currently through our hearing aid benefit.
Appreciate that response. Questions for the Department of Health Committee? Representative Penn.
Thank you, Mr. Chairman. I'm just looking at the numbers and trying to, maybe I missed some things, but I thought that I heard that it was estimated that there would be about 360 people that might be eligible for that. Is that correct? Looking at the fiscal note, the $90,000 appropriation says that it would serve about 30. And so I'm wondering where the numbers come from and where are we headed with this if we go ahead. Seems like the bill's going to be a lot bigger.
If you know where those numbers came from, go ahead.
Mr. Chairman, Representative Penn, I'll kick that question over to my colleague here for some more explanation.
Morning, Franz, go ahead.
Good morning, Mr. Chairman, members of the committee. My name is Franz Fuchs, Policy Analyst, Department of Health. Mr. Chairman, Representative Penn, that estimate came from, and there's uncertainty here because it came from census data. We looked at basically the number of people indicating hearing difficulty who are between 18 and 64, below 200% of poverty, and who are uninsured. And that there's kind of a range there, so it's somewhere between probably 200 and 700. That, because the bill is a little more restrictive on how it defines hearing loss and it's more severe, it would likely be less than that, but we just don't have a good estimate. I mean, we don't literally count everybody in Wyoming and assess their hearing effectiveness, right? This is based on survey data from the census.
Representative Ward.
Thank you, Mr. Chairman. I think Senator Furphy said the 367. Is that correct, Senator?
But did he get that number from you, Mr. Grossman, or the 367 is from census data? Mr. Fuchs?
Mr. Chairman, our estimate, we're not, maybe it might have come from an advocacy group. Our estimate was around 650, kind of as a higher bound. But that again includes anyone with any hearing difficulty, not just the more restrictive nature of this bill.
So Senator Furphy testified that profound means 80 decibels. Is that an industry standard? And if it is that something that you're aware of and that we need to define in the bill what profound hearing loss is versus hearing loss? Is that anywhere else in the Medicaid rules or somewhere else in rules and reg statutes? Go ahead, Mr. Griffin.
Mr. Chairman, this bill does include rulemaking authority for the Department of Health. So I'm certainly not an expert to be able to say that 81 decibel level, something that we would obviously define through the rulemaking process. I do have some information in front of me in terms of covered services and existing Medicaid standards, decibel levels. So we have that information in existing policy that we could obviously look to in terms of developing rules if this bill were to ultimately pass.
Mr. Chairman.
Go ahead, Representative O'Hearn.
Thank you, Mr. Chairman. The original bill had an estimate of around $500 per set. You guys are closer to $3,000. I think that's where Representative Chadwick came up with that 180 people served. Can you kind of straighten out where the numbers are coming from?
Go ahead.
Mr. Chairman, Representative O'Hearn, that's a great question, and we talked about this in committee across the hall a few weeks ago when this bill was up over there. And the $500 was actually a cost-sharing provision in the bill, is my understanding, and I'd welcome a correction if I'm mistaken on that. As you can see in the engrossed copy, that component was removed. So again, just my interpretation of and how we were planning implementation if that were to stay in the bill.
So if the bill passes, do you have a waiting population? Is there a marketing campaign to let the people out there know that this is now an available option well, let me first start. Are we really the only state that does not have some type of similar program? I don't know if you've researched that, but how would you expect people to become aware that the Department of Health offers this program? Would that be part of the contract work?
Mr. Chairman, to the question about my knowledge of Wyoming's status as the only state without such an office, that's correct to the best of my understanding. I certainly trust and rely on the testimony you heard earlier to that effect. And if you could remind me if there was a second part to that question, Mr. Chairman.
Marketing, or this contract position will find, how do you, I guess, locate the people who need this service?
Mr. Chairman, that's something we would obviously want to deliberate further on in terms of if we were to be implementing this program at the department level. Typically, Medicaid is not engaged in marketing to draw people in for our services, especially with having, again, just from my perspective, a relatively low number of folks that we would estimate to be served here. I think marketing would likely just exacerbate a expected waiting list for the program. But that being said, we would want to work with stakeholders and make sure that there's awareness in terms of how people would access and apply for this benefit with us. But that would not be the intent of the AWAC resources.
Okay. Other questions, committee? Representative Hornock.
I asked earlier, do we do this with blindness, with the need for dentures, with other things of this type of nature that can be fixed with some type of outside, element?
Go ahead, Mr. Grissom.
Mr. Chairman, Representative Hornock. So I think the short answer to your question is no, with a few caveats, if I may. So this would be unique in that this is 100% state general fund. So I just want to make that clear. We're not getting federal match as we do through Medicaid with this particular program. In terms of what we implement in the Medicaid area, to the best of my knowledge, elsewhere in the Department of Health, I don't believe we have a program that's quite as targeted in terms of dentures, blindness, but I'm going to look to my left to Mr. Fuchs to see if he has other information.
Mr. Fuchs.
Mr. Chairman, Representative Hornock. So I think there's broad eligibility categories in Medicaid called, age blind disabled. And so blind kind of fits in there, but I think most of that comes through either SSDI or SSI. So if folks qualify for disability based on their blindness, then they would qualify for Medicaid. I don't think there's a specific Medicaid eligibility category just for blindness, but we'd have to get back to you on that.
So Medicare for elderly people does not cover hearing aids necessarily. Medicaid can. Within the aspects of people that you serve through the health department, have you been doing this already through the Medicaid program to eligible people? Have you already served, because they're eligible within the Medicaid program, have there been people already that have received hearing aids from the funds that you guys control?
Mr. Grossman?
Mr. Chairman, Representative Hornock, yes, that's correct. If someone is eligible for Medicaid based off of current eligibility groups, that's a covered benefit. I think I just heard to my left that we cover about 460 individuals, or we've paid for about 460 individuals to get hearing aids. And I don't know, was that over the last year? Annual number.
And that wouldn't count workforce services through their SSDI or through vocational rehabilitation. They also offer similar services and perhaps hearing aids for those people under some different criteria in the workforce, as far as you know. That's just Department of Health data, not the total amount of maybe state spending through our Workforce Services Department.
Mr. Chairman, SSDI would likely be Medicare, and then they might have Medicaid as a supplemental, and if they do, that would be included in those numbers. We would not include any workforce services data in that.
Other questions, Representative Hornock, third time.
Yeah, thank you. So what would be added here then if somebody eligible for Medicaid within the state of Wyoming is already receiving this service, they're already eligible for hearing aids, there have already been, well over 400 people served. What are we adding then with this bill that would make it good, make it a requirement, make it something that we should really invest money in?
Taking debate this time. Go ahead.
Mr. Chairman, Representative Hornock. So I would draw your attention to page 3 of the bill, and specifically starting at lines, let's see, on line number 10. So this is the eligibility section of the bill. And from my interpretation, in terms of what this would look like if passed and how we would go about implementing it, if an individual applied for this program, they had other third-party insurance, they had Medicaid, right? So we already knew that this person was eligible for Medicaid, then they would not be receiving benefits through this program. So in order to be eligible, if I were submitting an application and met the clinical qualifications, I would have to not have any other coverage, essentially be uninsured. And that's what we would be looking for before anybody would be eligible to receive the benefits. So it would really be in addition to and separate, if you will, from the Medicaid benefits. But I hope Representative Hornock, Mr. Chairman, that answers the question. Happy to follow up if not.
Okay, other questions, Department of Health? Not seeing any. Don't go too far, though. AARP, I'm just guessing you want to testify? Welcome, Mr. Laycock.
Well, thank you, Mr. Chairman. Committee, I'm Tom Laycock, AARP Wyoming. We're a membership organization for people 50 and over in the state. While this bill isn't limited to people, older adults, it's sort of the lens we see things through, so sort of bear with me in that regard. We're supportive of the bill. A few things to kind of take note of. We know that treating hearing loss is important because it does have a link to memory loss. A recent study found that hearing aids may reduce dementia risk by nearly half. That really reinforces the idea that hearing is important to being able to stay at home and age in place. Now, Medicare does not cover the cost of hearing aids in Part A, B, or D. There is some small coverage under C. There are also some coverage in Medicare Advantage programs. Although with the population that we're looking at here, remember this is 200% of federal poverty level, which comes out to just a little under $30,000 a year for a household of one, or a little under 40 for a household of two. Those folks probably aren't able to fund a Medicare Advantage program. So I know we've heard a little bit about the idea of hearing amplifiers, so the over-the-counter things. Now, those came available in August of 2022, and when appropriate, they're fantastic. FDA suggests savings of up to $2,800 per set of hearing aids. I'm not sure that's necessarily once again, the population that we're looking for. We're looking for that person with profound hearing loss. And so for that reason, we're very supportive of the bill. It's a very small appropriation, and it's very niche. So we think this is a tremendous win for people that can benefit from this particular effort.
Questions for AARP? Seeing none. Thank you, Tom. Other people here in the audience to testify on the bill? Or against? Come on up. Welcome.
Good morning, Mr. Chairman. Thank you. My name is Scott, and I own Deaf Intervention Services. I am a licensed teacher of the deaf and a sign language interpreter in the state of Wyoming. I did want to share some data with you guys that would be helpful. So first of all, we are the only state in the United States that does not have a commission for the deaf, a school for the deaf, or a nonprofit that provide, or have a nonprofit that provides support for deaf and hard of hearing of all ages. And with that, having closed our residential school for the deaf approximately 20 years ago, now we're seeing some of the results of that into our adult population here in the state of Wyoming. And so I hope that answers some of your questions, Representative Hornock, about other similar programs. An estimate done by Workforce Services about in 1991 was that there's somewhere between 300 to 1,200 deaf and hard of or profoundly deaf in the state of Wyoming that use American Sign Language to communicate. And so profoundly deaf individuals, and they may or may not use American Sign Language, they may use spoken English to communicate. Jen Davis, in consultation with the governor and Senator Furphy, completed some research, I believe, a year or two ago that provided some additional data. However, there has not been a comprehensive data collection like there was in 1991 by Workforce Services. We have only approximately 10 certified sign language interpreters in the state of Wyoming. And so for 300 to 1,200 people that are deaf or hard of hearing and using sign language to communicate for everyday tasks with our auditory verbal world, you know, that's the way we communicate, it's not sufficient. It doesn't meet the needs of that population. And we are talking about a low incidence disability. So we're talking about a disability that impacts less than 1% of the population in the state of Wyoming. However, in our state, there's somewhere, the last time my company did research on this was in about approximately 2019, 2020, and the data that we collected was that there's about 29,000 deaf and hard of hearing in the state of Wyoming. However, we are talking about specific defined profound hearing loss, which, as the Department of Health mentioned, you know, would need further consultation. I don't know if we have an audiologist online who's going to testify or someone in the audience. But me as a teacher of the deaf, that does sound correct, approximately 80 decibels, but that does need consultation with an audiologist. So someone with profound loss, I mean, a hearing aid could cost somewhere between $4,000 to $7,000. And we're looking at more like a car payment for someone with a low incidence disability who's already having difficulty securing a job just with those communication barriers. In terms of a marketing campaign that was mentioned, that might not be a concern for the state in terms of trying to get information out there about this program, because I assure you, the deaf people that I'm in connection with within the state of Wyoming would make sure that this information is made available to members of our community. Our company provides free advocacy services to deaf and hard of hearing of any age. And so we would make sure that that information gets out to the public as needed. Any other questions for me, Mr. Chairman?
Questions, Representative Penn?
Thank you, Mr. Chairman. First of all, I just wanted to say thank you for doing what you do to offer the services, to the people who need it. So thank you for that. I have two questions. The first, do you have, with your associations and your circles, do you have any weigh in on what numbers we would be looking at? We're hearing anywhere from 200 to 700, or do you have any estimation on that?
Mr. Chairman and Representative Penn, I do not. Again, we need a more comprehensive research on that within the state of Wyoming. And unfortunately, I myself have had difficulty gathering that data. It is necessary. We do need to know. And as Senator Furphy mentioned, we don't have all the answers. This is just a starting point. And the reality is we are kind of trailing behind the rest of the states in the United States in terms of a commission for the deaf, because unfortunately what happens when we have a lack of these resources in our state is that it can create ADA lawsuits, and that can drive up healthcare costs, that can drive up other challenges. Additionally, we have to bring sign language interpreters in from out of state. And so I wish I had those numbers, but I do not. My best estimate is probably similar to what Workforce Services described in 1991, is somewhere between 300 to 1,200. And same with the Department of Health. It kind of aligns similar to that. So we don't have those exact figures.
Follow up.
Thank you, Mr. Chairman. I believe at the beginning you mentioned that we don't have a commission, we don't have a school for the deaf, and we don't have a nonprofit. Have you or those in your world looked into nonprofits or creating a nonprofit?
Absolutely, yes. That's something I'm definitely working on. It's not an overnight solution, but I've been working on that for the last 5 years or so, yes. But we're not there yet. Thank you, Mr. Chairman and Representative Penn.
Representative Hornock?
Chairman, so I'm pretty in tune with this type of thing. I'm lost without my hearing aids. My father has to have hearing aids to function. I just had a sister that, through an illness, lost 80% of her hearing in one ear and is deaf in the other. It's something that I kind of understand. I live in that world a little bit. Do you think that when we're talking about profound hearing loss, but this doesn't cover an implant situation, which usually helps quite a bit, do you think that hearing aids provides the help that these people are looking for when it comes to profound hearing loss? Because that's on another level than just somebody like me who blares the TV to hear and then it's okay, kind of thing,
Right. We're talking about the type of hearing loss that impacts your ability to function in daily life, which meets the definition of a disability. So my answer would be yes and no, because it depends upon the person, it depends upon the background. I would say that in 17 years of working in this field, and I've worked on all ends of the spectrum, from working with a deaf child who has no one else that's deaf around them, all the way to working at a school where there's 400 staff member and 400 children who all use sign language to communicate from birth to 21. And so on every end of that spectrum, it depends because there are no two deaf people that are alike, and that includes hard of hearing. And so, yes, it helps. It will help the individuals that are seeking out that assistance and want that, because whether it's a profoundly deaf person who primarily uses American Sign Language to communicate, that hearing aid could save their life standing on the edge of a curb in Cody, and a bus just blares by and they don't hear that without a hearing aid. Whereas someone else, they may have grown up using spoken English to communicate and still they're profoundly deaf, but they still use English in their daily communications. And so that hearing aid could still provide that assistance. So my answer is yes and no, Mr. Chairman and Representative Hornick. It will provide benefit.
Okay, you have follow-up?
Yeah, thanks, Mr. Chairman. So you brought up something that I hadn't thought about this too. We specifically define the eligibility as being somebody 18 years of age or older, but what would your thoughts be about expanding this to children as well? Because there is a population that would really be helped, and oftentimes parents dealing with a deaf child or hard of hearing child, like me, it took me, I was in my 30s before I got hearing aids. I probably could have used them through school, but there's no way I could have afforded, or my parents could have afforded a $5,000 price tag for that kind of thing. What would your thoughts be about kind of expanding that?
100%. I do believe that there does need to be expansion in that as well. We do have a program. Unfortunately, I will say it's very unfortunate for the timing because right now today up in Casper is an event called Y-High. And deaf and hard of hearing people come from all over the state from different schools, and it brings in a lot of the adult deaf and hard of hearing population throughout our state, and they all flock to Casper, where the School for the Deaf used to be, and Casper College puts on an event. So I don't even know if we have Wyoming Hands and Voices here. However, they do provide support for, or perhaps they're online. Wyoming Hands and Voices does provide support for children, school-aged children with hearing loss. And I believe is that the CHIP program, Senator Furphy? So that program is available. I do believe it does need some expansion, and it could be more beneficial to just merge it into an existing program that is already made available to, because Wyoming Hands and Voices is a nonprofit, but their focus is limited to, we don't support all ages. We only support school-aged children. And so that creates the challenge where, as I mentioned, with the School for the Deaf being closed, now we're pushing into adulthood where we have all of these gaps that are now showing and impacting our workforce. And so, or another suggestion could be that the funding could be altered into a more broad, excuse me, a more broad scope in terms of providing more comprehensive support, whether and I can tell you it impacts every aspect of government, whether it's a judge who denies a sign language interpreter in the courtroom, because it's happened in our state, or whether it's, a consultation with the Department of Education, or it could be very broad in the sense that you could use the funding to help support a commission for the deaf, which would give you a greater scope of support for services throughout the state. So that's another option.
Okay.
Mr. Chairman and Representative Hornick.
Thanks.
Did that answer your question?
And then some. All right, seeing no further, thank you for being here very much.
Thank you, Mr. Chairman.
Are you going to Casper later today then?
No, I wish I could.
Thanks. We do have one person online, Robin Momsen. If you would like to testify, we will bring you in. Give it just a second. We'll start video later. Maybe we're just listening. Okay, maybe it's just wanted to be in the hearing and not testify, I guess. Anyone else here to testify on the bill? Seeing none, we will close public comment. Committee, what's your pleasure on Senate File 557? Moved by Chadwick. Second by O'Hearn. Discussion, committee members. Somewhere in all my paperwork, I must have, oh, it's under my computer. I'm hiding my own bill. All right, we can go through page by page unless anyone has any specific questions or comments. I did have one question, Department of Health. The money is going to revert in 2 years. Was there a conversation on just keeping that money in the fund until it ran out, or do you anticipate putting it as, including it in your biennial budget in 2026? Mr. Grossman?
Mr. Chairman, pulling up the fiscal note here, or excuse me, the text of the bill, my recollection is that on page, let's see, page 5, let's see, line 16, that we do have guidance that this appropriation be included in the standard budget for the immediately succeeding fiscal biennium. So,
I guess that makes sense, is one way to do it. Any other questions, discussions on the bill, committee? Representative Ward, go ahead.
Thank you, Mr. Chairman. I do feel great sympathy for these folks and this population, but I just don't think this is the role of government. So I'm going to be voting no.
Other comments, discussion, committee? Seeing none, and question being called, and I think Representative Clausen did leave a vote. I forwarded you his message, and we'll leave it open for him, but go ahead and call the roll on Senate File 57.
Representative Chadwick. I'll leave it open for Clauston.
Thank you.
Representative Hornock.
No.
Representative O'Hearn.
Aye.
Representative Penn.
No.
Representative Trujillo.
No.
Representative Ward.
No.
Vice Chairman Yin.
Aye.
Chairman Swanitzer. 4 aye, 4 no.
We will await Representative Clausen's return on that one. Sorry to leave you all in anticipation and hanging if that's going to pass or not. But I'm sure Clausen will be here before 10 o'clock. With that, let's move on next to Health Insurance for Volunteer Emergency Responders, Senate File 8. Joint Committee Bill from the interim committee. It does not appear, anybody have a blue copy? It doesn't appear our good colleagues down the hall amended this bill whatsoever. So it's not engrossed. It's nice when they don't amend our committee bills. So again, committee, what this does is allow our volunteer firefighters, EMTs, volunteer search and rescue persons to participate in the state employee officials group insurance plans, gives the requirements of what it takes to be able to be enrolled, goes through the timelines, goes through the percent of the meetings they have to attend, 25% of calls of services. You'll see there on page 3. I didn't know if anybody else in the audience wanted to present the bill. I was just going to walk through it because it hasn't changed. And then basically allows any of those volunteers to sign up to the state plan under certain stipulations or circumstances. With that, if there's any comment, public comment on the bill on Senate File 8, now would be a great time to come forward. Okay. Technically, Representative Byard, are you going to talk on the bill? As a legislator, I'm supposed to give you first. You want to set the table with them? Okay. Welcome. Floor is yours, Forster.
Good morning, Jared DeLay, Wyoming State Forestry Division, Assistant State Forester, Fire Management Officer.
Good morning, Mr. Chairman. Christopher Ballbeck, the Assistant Fire Management Officer for the Office of State Lands and Investments, Forestry Division.
Mr. Chairman, this bill helps support the wildland fire suppression community, recruit and maintain qualified volunteer firefighters who are needed to respond to private, state, and federal wildfires throughout Wyoming. Wyoming's volunteer fire districts and departments are typically the first to respond to a wildfire and are integral to wildfire response efforts by keeping wildfires small and containable, thus keeping the costs associated with suppression low. The quicker the initial response, the less likely the costs associated with a wildfire will increase exponentially. Thank you.
More? Go ahead.
Mr. Chairman, the only thing that I'd like to add to that is that we have no objections from the Forestry Division on this bill. This does not impact our budget since the volunteer firefighters that choose to enroll in the EGI system will cover the cost at 100%.
Any questions for State Forestry? Representative Hornock?
Technical question, I suppose. If we have volunteers, I imagine there's a way to, because this talks about the monthly contribution requirements being, I guess, a lot of times for state employees, they're just deducted from their paycheck. If we have volunteers that aren't getting a paycheck, how will those costs be deducted, I guess?
Go ahead. Either one who wants it.
I get, how will they, if I understand, Mr. Chairman, Representative, if I understand it correctly, are you asking how are they going to buy into this? Is that?
Representative Hornock, if you clarify your question.
Yeah, sure, Mr. Chairman. So is there a mechanism for them to, I imagine there's some way for them to make the payment required, even though they're volunteer, they're not getting a paycheck. Usually it's deducted from your paycheck automatically, but I imagine there's some mechanism in place. I'm just want to make sure that there is, or if they're going to get a bill, or I don't know what that exactly is.
Mr. Chairman, Representative Hornock, if I can follow up on that, I have a little bit of personal experience with that. My daughter has aged out of the current EGI system and is still currently enrolled in a COBRA plan through Wyoming Group Insurance. That was established working through EGI, establishing a monthly draw that is automatic. I would assume, though I wouldn't want to speak for the insurance group plan, that it would be in the same kind of mechanism as that, as far as for paying the premiums.
Other questions for State Forestry? I never thought they'd become into labor health so much, but we're happy to have you. Thank you for being here. Representative Byron.
Thank you, Mr. Chairman, Committee. I'll try to keep it as brief as that. Today I come to you wearing a little bit of a different hat as a volunteer firefighter in Western Wyoming. I'm about my 9th year at Hoback Station 3. We cover the Hoback Canyon, the Snake River Canyon, millions of miles of our state forest with our partners that were just speaking, structure fires, hazmat, swiftwater rescue, I could go on and on. I currently am one of 6 firefighters at Station 3. Honestly, right now, there's 5 because I'm down here. But when I came on, our station is fully staffed at 12. So right now, we're running at a little bit less than half capacity. We have 4 apparatus. We'll be lucky to get 1 out of the engine and out of the station at any given day. What this bill will offer is an opportunity for not only a recruitment tool, but a retention tool. We've seen a lot of turnover and folks having to leave because of a number of factors, but most importantly, it's tough to volunteer because it's expensive to live in any part of our state right now. So, there's been some talk about, and if you read through the bill, I think to answer your question, Representative Hornock, it very clearly states that firefighter will contribute. So I think they could do a withdraw, a check, a credit card, they will be paying into it. But I think it's really important to know that we need statewide to keep our volunteer structure healthy and staffed. We are, it's over, I think before I got off of probation, I had over 650 hours of training. Any given year, even with our time down here, I'm spending 4 to 5 days on calls and at training. So hundreds of hours a year. So I stand in support of this bill. I think it's Wanted to open up the opportunity for anyone to ask me questions, so you could, I'm sure you heard it during the interim testimony from other firefighters, but I think it's important to hear from one of your own that also wears a different hat.
And a different colored jacket on Fridays. Any questions for Representative Byron? Seeing none.
Thank you.
For being here very much. Other people wish to speak on the bill? Wyoming County Commissioners Association. Welcome, Jonathan.
Thank you, sir. Mr. Chairman, members of the committee, Jonathan Russell, Wyoming County Commissioners Association, here in support of the bill in a field that is lacking personnel. We see this as a great tool for recruitment and retention, so that's why we are in support of it. And I am willing to answer any questions.
Questions to the county commissioners? Seeing none, get off easy. Other people to testify on Senate File 8. Mr. Applegate, welcome. Floor is yours.
There, Mr. Chairman, good morning, committee, good morning. Lanny Applegate, representing the Wyoming Fire Service. I just want to note that obviously we're in full support of this here. There's no question about it that we're a shortage of volunteers across the state. There's approximately 141 fire departments across the state, and approximately 3,200 of those or more are volunteers. There's a lot of them that have health insurance through their employer, but there's a lot of them out there, especially in the rural area, the ag areas, et cetera, that don't have that opportunity. So this here would give them an opportunity to buy health insurance. And the one thing that would be important is this health insurance has to be paid in its entirety by the individual fireman. There is no cost to the state, none whatsoever. And I believe the bill, if you read it, it states in there that you can't have contribution by cities, towns, counties, fire districts contributing to that. Again, 100% of it is paid by the volunteer firemen. And I left a handout for you folks today, and if you get a chance, take an opportunity to read that there. But this is truly, without question, a recruitment retention tool. Like I say, the volunteers, as you heard from Representative Byron earlier, there's a shortage statewide. So with that, I would stand for any questions.
Questions for Mr. Applegate? Remind me who you're representing?
Wyoming Fire Service.
Wyoming Fire Service.
Chiefs, Wyoming Fire Service.
He's our former state fire marshal. Former state, a lot of things, has a very long
I
distinguished
had
career.
31 years as a volunteer, so.
And any questions? Seeing none. Thank you, Lenny.
Thank you, Mr. Chairman. Thank you, committee.
Other testimony on Senate File 8. I think we have one person online. Actually, we have two people online. Mr. Cooper, go ahead. Welcome, Shad. Floor is yours.
Good morning, Chairman Dwanitzer and members of the committee. Thank you for allowing me to provide testimony. As Mr. Applegate had mentioned, this is I'm sorry, I needed to introduce myself, didn't I? Sorry about that. My name is Shad Cooper. I'm the fire chief and county fire warden for Sublette County Unified Fire. I also serve as the president of the Wyoming Fire Advisory Board. Thanks again for your time here today. I appreciate everybody's consideration. It's nice to see everybody again after the long interim period and the work we put into it, and super happy to see this bill in front of everybody. As you remember, it was supported unanimously when it came out of committee during the interim period. So as Mr. Applegate had mentioned, this is absolutely a critical tool for recruitment and retention for the Wyoming Fire Service. I've heard many times from firefighters across the state who have asked for follow-up information, how's this bill progressing, and how important it is to them to be able to access affordable health care and be able to enroll in the state's group healthcare insurance plan. The important thing to the firefighters is the cost for this is, you know, in many cases substantially lower than it'd be if we purchased it, you know, through the marketplace. And I believe there's other people that can testify to that in more detail. For me, for my own organization, our own firefighters, you know, there's no financial appropriation from the state to provide this coverage. So in our own organization, our firefighters are fully aware that they'll be you know, required to pay for this themselves. This comes completely out of their own pocket. There's no assistance. But even you know, with that, they understand that, and they're still excited about the opportunity to access that healthcare program. So with that, I think everything's been already addressed. So I'll try to be brief in my comments. But thanks very much for your time and consideration, and I encourage your favorable consideration when you come to vote. Thank you very much.
Thank you. Questions from Mr. Cooper? Seeing none, Chad, but thank you for appearing. Next up, also online, Ms. Mumson, welcome. Floor is yours.
Thank you, Chair Zwanitzer and House Committee members for giving me the opportunity to speak today. My name is Robin Momsen. My husband, Chris Momsen, is a 21-year volunteer firefighter with Jackson Hole Fire EMS and captain of Station 2 in Wilson, Wyoming. Chris and I are both self-employed, and like many ranchers, farmers, construction workers, tradesmen, and small-town professionals, we do not have access to an employer-provided group health insurance plan. We buy our individual family health insurance directly. So I want to briefly explain some economics of that. Our current Blue Cross Blue Shield of Wyoming health insurance premium is $2,885.29 a month. And it's the bare bones Bronze Blue Select Bronze Core High Deductible plan. Our family deductible in network is $12,000. Out of network, it's $40,000. Our family maximum out of pocket in network is $14,300, and out of network, it's unlimited. Maximum out of pocket. Ouch. So we pay a lot of money every month in premiums for a policy that is frankly not great. In comparison, the state of Wyoming group plan for 2024 provides several plan options with premiums for our family between $2,436 and $2,059, with deductibles between $900 and $4,000. And there's actually a maximum out of pocket number. It isn't unlimited. This is much better insurance coverage for less cost. So the opportunity this bill, if passed into law, would provide our family is very meaningful. Why do you care about that? You care about that because my husband is a 21-year volunteer firefighter, putting his life on the line for the citizens of this state for 21 years and counting as a volunteer. The state, through its counties, does not have to pay a salary and benefits for him or the many other volunteer fire EMS and search and rescue personnel who serve the state. They serve this state with a passion unrivaled, without salary benefiting their families. Their very existence is a huge cost saving to the state. If the state, through its counties, were required to fund an all-paid fire department, the cost would be crippling to the already strained budgets. We should all embrace every opportunity that we have to increase recruitment and retention of volunteer fire EMS and SAR personnel, especially when, as is the case with this bill, such support doesn't cost the state anything. The volunteers pay the premiums. There is no appropriation associated with this bill. This bill does not ask for the state to pay for our health insurance premiums, as if my husband were a state employee. We just ask for access to the state's superior health insurance plan at our cost. This bill allows my husband, and by extension our family, to join the group of state employees for health insurance purposes. I can think of nothing more appropriate for a dedicated volunteer firefighter. And having access to the state health insurance plan will be a recruitment tool for SAR and fire EMS departments statewide. It will also be meaningful for retention. I, for one, will be even more supportive of the time my husband devotes to firefighting training and calls for service if our family has access to better health insurance by virtue of that service. This year alone, my husband made 83 calls for service and 35 trainings. Those trainings are multi-hour trainings every Wednesday of the week. And he made those calls for free to the state. I, for one, will be more supportive, and I do support this bill. I ask you to please support this bill and the other bills before you that support recruitment and retention of volunteer firefighters, EMS, and SAR personnel. Not doing so could cost the state considerably in the future if volunteer recruitment and retention fails, and you have to find funding for an all-paid fire EMS and SAR service. Thank you for your time and your service. I'll stand for any questions you may have.
Questions for Ms. Momsen? Representative Penn, go ahead.
Thank you, Mr. Chairman. First of all, thank you for the service of your family and your husband. We all know that if you have one member of the family that's volunteering that much, that affects the whole family, so thank you. You gave us some numbers on what your estimation, I think, of the premiums that you would be paying if this bill were to pass. Could you just tell me those again, please?
Yes, ma'am. I believe the let's see, the premiums range between $2,059. This is for a full family plan. We have 2 children. They range between $2,059 to $2,436. We presently pay $2,885. So that's a small savings on premiums, but the coverage is drastically better under the state plan. Would you like those numbers again?
We're good. Thanks. Other questions? Seeing none. Thank you for appearing remotely from Teton County.
Thank you.
Representative Yen says aye. Other people here to testify on Senate File 8? Seeing none and seeing no further people online, we'll close public comment on Senate File 8.
Move the bill. Second.
Committee, what's your pleasure? Moved by Representative Yen and Representative O'Hearn seconded that motion. Make sure I'm not going too quick. Good? Okay, committee, any amendments, any discussion, pontifications? Representative Hornock.
Thank you. Question, just for some clarification, on page 6, talks about enrollment eligibility. And maybe I'm just reading this wrong, but it seems to talk about somebody who enters service. There's the term enter service several times. Is this, from here on out, a person, if this bill passes, a person that enters service gets to elect whether or not they want this coverage. But I just want to make sure that current volunteers are also included. I don't see that language.
Representative Hornock, shoot, I know I have seen it. As soon as the bill passes, any current volunteer can immediately, it's on page 2, I think on line 7. The volunteers are eligible to enroll in the group insurance plan within the first 31 days of enactment. Or if they don't do it right away, you have to volunteer for at least 90 days and then have a 31-day window. And because of those, you still have to meet all the other qualifications there on hitting the, being at the meetings, being on the number of calls, et cetera, and then not being eligible for another insurance program.
Mr. Chairman, I think on line 12 on page 2, eligible volunteers who elect not to become enrolled within the time prescribed in the subsection may be enrolled at a later date upon conditions. And so
And
I think that covers what our concern is.
I'm guessing that would be the standard open enrollment period, probably. The plan opens usually in November each year. Other questions, thoughts? Seeing none, and someone calling the question. If you would call the roll on Senate File 8, Barb.
Representative Chadwick. Representative Klausner.
Aye.
Representative Hornock.
Aye.
Representative O'Hearn.
Aye.
Representative Penn.
Aye.
Representative Trujillo.
Aye.
Representative Ward.
Aye.
Vice Chairman Yin.
Aye.
Chairman Zwanitzer.
Aye.
9 aye.
And I'm Representative Byron, even though you're not a member of the Labor, Health, and Social Services Committee, would you like, on the floor?
You would love to.
You haven't know what I asked yet. But walk out the door and I'll keep asking questions. We'll be good. You have a good morning. Congratulations. Next up, committee, we are going to go to Senate File 6, Nursing Home Administrators Temporary Licenses. We'll give it a second for the room to clear here. Have a great day. This was another interim committee bill that apparently our good colleagues down the hall didn't touch. We must be doing really amazing interim committee work. And this was brought to us, actually, Mr. Boley, you're here. Do you want to come up, and Ms. Reed? We have 3 chairs. Anybody who wants to testify on the bill, come on forward. This is brought to us as a small tweak we need in our laws in the interim. There wasn't a whole lot of conversation because I think it sounded so kind of, yeah, obvious need. But if you just remind us maybe, Ms. Reed, what the need is and why this bill's before us.
Thank you, Mr. Chairman. Members of the committee, I'm Joanne Reed. I'm the administrator for the A&I Professional Licensing Boards. Normally, Emily Cronbaugh is the executive director for this board. She wasn't able to join us today, so I'm going to try to answer your questions to the best of my ability. Would you like to just walk through the bill, or any need for that?
Sure, if you just give us the background. I mean, I think we all read the bill, so.
Okay.
Give us the need and the why, and then we can have any questions.
Okay, thank you, Mr. Chairman. Page 2, lines 1 through 8 are providing a temporary license for applicants who have submitted all requirements for licensure to start practicing while the board awaits the results of a background check. We heard testimony in the committee across the hall that the nursing homes themselves also perform background checks for these employees. So there's some assurance that the public's continued protection. Lines 10 through 15 would provide temporary license for an individual who must complete their supervised experience hours and the required national examination to obtain a full license. And lines 17 through 23 would provide a temporary license for emergency situations when a licensed nursing home administrator unexpectedly leaves and another qualified staffer must step in and assume the nursing home administrator's role while permanent replacement is found. With that, I will stand for any questions.
And the need for the bill, and maybe that's more for the guy next to you. We'll talk about the need and the why. Go ahead, unless anybody has questions for the board. Seeing none. Mr. Bully, go ahead.
Mr. Chairman, committee members, Eric Bully with Leading Age Wyoming, and we're a long-term care association. If you'll remember, I think it was in Saratoga, I had to lean on Representative Chadwick to help me bring this back so it could be considered as a committee bill. But realistically, a couple of years ago, we passed legislation that we thought had addressed this and fixed this, and then we were informed that it hadn't done exactly what we wanted. So this is just a fix to legislation we passed a couple of years ago. Temporary licenses are very, very important as we have so much turnover going on right now within the industry. For whatever reason, this just allows the Board of Nursing Home Administrators to issue those temporary licenses while they go through the final licensing process. And there are multiple different examples I could share with you. And as Ms. Reed said, we have all kinds of background checks that we have to complete before we can even employ within our nursing homes. And so there are safeguards in place until the final background checks are completed with DCI and other things. But we're staying in full support of this and just ask you to help us fix something that we thought we'd already fixed a couple of years ago. I'll answer any questions. Thank you.
Questions for Mr. Bully, representing Leading Age Wyoming today?
Yes, sir.
Seeing Representative Hornock.
Might be a question for either of you, but can you just remind us, I know we discussed it in the interim, but remind us what the qualifications are for licensure, what it takes to get a license, and then in this delay that we're allowing in this, and I think it's because of the background check and other things, there's a delay to that. How do you ensure that you don't get bad actors that kind of sneak in under the radar?
Go ahead, Mr. Bully.
Mr. Chairman, Representative Hornock, I can answer the question about becoming a nursing home administrator. In 1999, we built a nursing home at my hospital in Kemmer. And my CEO at the time told me, hey, you need to go get your nursing home administrator's license. I said, okay, that sounds easy. And it wasn't. I had to go through 6 months of administrator and training, which basically meant I shadowed her, who was licensed. I attended all of the different resident council meetings, was involved in all the subcommittee meetings. I had to test. I had to go and take a remote test. I traveled to Salt Lake to take that and then waited 3 weeks for the results. It has a pretty high threshold as far as what's required to be licensed. And then I went through the application process with the Board of Nursing Home Administrators and awaited my license. And so I think that AIT course is probably the biggest part of that. It's hundreds of hours of training under a licensed nursing home administrator.
Other questions, Representative Clausen?
Thank you, Mr. Chair, Mr. Boley. In support of this, just one question is, who oversees these temporary licensees to make sure that they're doing a good job taking care of the nursing home? Like, who are they reporting to, just so we know that things are being handled appropriately?
Mr. Boley?
Mr. Chairman, Representative Clausen, so I'd say it's a two-pronged approach. One is the Board of Nursing Home Administrators has authority over revoking the temporary or not issuing one. Secondly, it would also be management of those nursing homes in addition to license and survey. So our nursing homes are surveyed annually and also regularly if there are complaints. And so the State Department of Health under the Office of License and Survey would go in and make sure that everything is up to snuff.
Okay. Other questions? Another one, Representative Hornock?
Thank you, Mr. Chairman. I'm looking for anything specific to, but it's more general. It says the temporary license will be, the validity period of that temporary license, I think that might be up to the board or something. It is, should we put some parameters on how long the temporary license should be? I mean, it does take a while to get a certification. I understand that, or training, that kind of thing. But, you know, is there a situation where somebody keeps failing the test and we keep extending the temporary license year after year? You know, should it be important to put some parameters on that period for temporary licensure?
Don't you think we should do that? Maybe on page 2, Ms. Reed?
Thank you, Mr. Chairman. Representative Hornock, you are referring to, this is 3 different temporary licenses, and I believe that you're referring to the emergency temporary license that starts on page 2, line 17. Is that correct?
I think he might be referring to page 2, lines 13 through 15. You can only get a license for 6 months, and you can't receive more than 2 temporary licenses for the duration before they have to fully be certified. Would that be correct? That after 2 bites of the apple, no more temporary license?
That's correct, Mr. Chairman.
Okay. Other questions, committee? Seeing none, thank you both for being here.
Thank you.
Other testimony from the room, intern pool, hospitals, guests, Cheyenne Regional, Department of Health, AARP. You're all just waiting to see how Clausen's voting, aren't you? On the other bill. You missed a fun one this morning, Representative Clausen. We'll get back to that in just a second. Okay, so no public comment on Senate File 6. We'll close public comment. Committee, what's your pleasure? Moved by O'Hearn.
Second.
Seconded by Chadwick. Like last 4 bills, you guys have moved in second. And they are quick. Any discussion on Senate File 6? Representative Hornock.
And so I think I would like to propose an amendment so that we just put some parameters on the emergency license. There is the, 2 bites of the apple thing on page 2, lines 10 through 15. But when it comes to emergency temporary license, page 2, line 17 through top of page 3, that is not necessary. There's not really a parameter. I'd like to put the same parameter, the 6 months and the 2 separate temporary licenses kind of thing. I wonder if that works under the emergency licensure, or if the emergency licensure would be covered under the pending licensure thing. I'm wondering if that works or not, but I would like to put some parameters on that.
I don't think I disagree. I'm just not sure how to do it. And maybe we could ask for a conceptual amendment or some work with the state or the association to come up with a committee of the whole amendment. It is a little tight that you can't have a current other nursing home administrator. I mean, I'm sure if somebody quits and you have to have somebody fill that role quickly, I understand the need, but you're right, we could put some more sideboards on it. I'm just not sure what the correct way to do that is, but if you have a recommendation, we could certainly try one out, Representative Warnock.
Yeah, Mr. Chairman, so line 21 on page 2, it says, it starts a new sentence, a temporary license issued under this paragraph shall be valid, and then I think I'd like to say for not more than 6 months.
And then delete for the period established by the rule of the board.
Correct.
Is there a second?
Second.
Seconded by Ward. So again, it would say on line 2, starting on page 2, line 21, a temporary license issued under this paragraph shall be valid for 6 months. And then delete for a period, for not more than 6 months, and then delete for a period established by the rule of the board. Make sure I get that correct.
Correct, Mr. Chairman. And then I'm wondering if on the top of page 3, under section B, if line 4, period, that temporary license is valid. I'm wondering if we need to put the 6 months there, or if that language on the last part of that paragraph kind of already includes, since we did the 6 months on page 2.
So, Mr. Chairman, yeah, so all of the stuff in Romanets 1 through III is in subsection A, and B covers only the licenses available in those 3 Romanets. So that's the validity period still only is the same as III and III. So you don't need to duplicate it in B. It's already in III and III because those are the only valid temporary licenses that you can hold. Just to reframe your amendment, I think it's just exactly the same as the second sentence in Romanet 2. So on lines 12 through 13, you're just copying that sentence and replacing the last sentence in Romanet 3 with that second sentence. Is that correct? Okay, thank you.
Okay, other discussion on the amendment? All those in favor of the amendment say aye. Aye. Opposed say no. That amendment's passed. Further amendments, discussion, thoughts? Seeing none.
Question.
If you'd call the roll on Senate File 6.
Representative Chadwick.
Aye.
Representative Clauston.
Aye.
Representative Hornock.
Aye.
Representative O'Hearn.
Aye.
Representative Penn.
Aye.
Representative Trujillo.
Aye.
Representative Ward.
Aye.
Vice Chairman Yin.
Aye.
Chairman Zwanitzer.
Aye.
9 aye.
Anybody in the committee want to take this on the floor? Who haven't I picked on lately? For you, take what you want another one? Representative Trujillo? It could be up as early as today unless we get out of here early, and then it'll be Monday for sure. With that, let's briefly go back to Senate File 57, Wyoming Adult Hearing Aid Program. I know you missed some of the testimony, Representative Clauston, but if you would give us a vote by 10, if you want to think about it and let Barb know, or if you're prepared to make an aye or no vote at this time, we'd sure appreciate it. No pressure.
Thank you, Mr. Chairman. Yeah, I've read through this, and actually I visited with Senators Furphy and Baldwin on this. I'm an aye vote on this.
All right, we'd mark that down as an aye. And that also means you get to carry it on the floor. No, not necessarily. I will check with Representative or Senator Furphy and see which of his House co-sponsors are going to carry that on the floor. With that committee, we do have at least one bill on Monday on hospice. I might have another assigned today. I'm still waiting to hear from the speaker if we're going to get another 1 or 2 assigned to our committee for Monday. So if we do get another, it'll be at 8. If we don't get another, it'll be 8:30. So I'll let you know as soon as I know. Same to Barb. When I get the word, I'll pass it on quickly. With that, seeing nothing else before us, we're adjourned for Friday, March 1st.